Hey guys, it's Dr. Chad here today with yet another interesting case. Today's case is a very unfortunate patient of mine that's had a multitude of low back surgeries, and we'll kind of talk about that. It wasn't an issue of whether or not the low back surgeries were needed. He certainly needed them. The issue today is that the last surgery that was done incorrectly, and he's now left with what I unfortunately feel is going to be a permanent neurologic issue because of that surgery. So I want to focus on the x-ray here. This is looking at someone what's called a AP picture. So you're kind of looking at the patient from behind. You can see their pelvis, lumbar spine. And what clearly sticks out is this is someone with extensive hardware. He's even had the fusion extended into his SI joints. I mean, just looking at that is painful. And when I look at a spine like this, in my mind, the only reason you would ever get a surgery of this magnitude would be to maintain neurologic function. So someone that is incontinent, someone that can't walk because of numbness and weakness, that is the only reason you would do a surgery like this. You do not do a surgery like this thinking your back pain is going to get better. It's only going to get worse. With this much hardware, you have no mobility. These are people with what we call flat backs. They have very limited rotational flexion because this can no longer move. I'm gonna show you a different picture to show you what happened on his most recent surgery. And this is looking from the side. So this would be the back side, this would be the front side. This is the bone, and this is the disc. And when you put a pedicle screw, you want the screw to go down this bone here, which is the pedicle. So by coming in, this provides a stabilization. The yellow is the nerve. What you don't want is the screw to go below or above the bone and enter the foramen and stick the nerve. And when we look here, you can see these two screws line up, these two screws line up, and you can certainly see the difference we have here. And what's happening, this screw, which is on the left side, is actually going into the canal and sticking the nerve. When he had his most recent surgery, his left leg no longer works. So unfortunately, what he's looking at right now is to find yet another surgeon to remove the screw and try to replace it. But unfortunately, I think what we're going to find is because this has been done, that the nerve damage is permanent and not likely to get better. This is a great example of, again, the first doctor you meet being the most important. Always put surgery off to the last possible time and make sure that the surgeon that you do get to do your surgery, if it is indicated, is a competent surgeon and doesn't do things like this. I can certainly make sure you will never see this surgeon, but certainly, you know, there's fortunately a lot of guys out there that can do this type of stuff. So I hate to share these kinds of things, but you know, unfortunately, this is the world we live in. And you know, as always, I'll be happy to sit and look at any images with any patient to talk about your pathology, to talk about the appropriate options, to talk about less invasive options that you could have tried before getting to something like this. Unfortunately for this guy, you know, he's tried medical marijuana, it worked okay. He takes a pain pill every now and then, which really doesn't help him. And after he gets this screw fixed, he's probably looking at living with it, a pain pump, a stimulator. But be honest with you, when you have this much hardware and pathology and unfortunately damage like this, I'm not less than hopeful that any of those options are going to be groundbreaking for him. So that's all I have for today. Appreciate your feedback. Let me know your thoughts. Interact with me on social media if you know anyone else that's had a bad outcome with the surgery. And until next time, always a pleasure, guys. Take care.